Dr. Chris Jones. Welcome to Isokinetic London, where you return to play. I'm a medical doctor with a specialist interest in sports, exercise, and musculoskeletal medicine. My role at Isokinetic is to act as the patient's case manager. So I'm the first clinician to meet with the patient, to make the assessment, to identify any musculoskeletal issues or any other health issues, so that we can then plan a safe rehabilitation program. I love the team that I work with, the environment, and the patients we work with. I'm lucky to work with colleagues that can help deliver high quality care to our patients in their recovery process. The gym's large, it's open plan, patients can talk to one another, they can help motivate each other through their process. We have a hydrotherapy pool on site, and we have a green room, this room here. And I come down here and I do some of the movement analysis tests on our patients. Being able to come to these different environments and see my patients train and in their recovery process allows me to gauge where they actually are in this process. This is a phrase we use here at Isokinetic. We see patients from all different backgrounds, different ages, different sports, and every patient is unique. But our rehab methods remain fairly consistent. Whether the patient is an elite athlete, an amateur athlete, or a non-athlete, we go through all the different stages of rehabilitation. And in our consultation rooms, we have pictures of Mount Everest, and we use this as a pictorial representation to try and guide and explain the recovery process to the patient. And at the end of that is their goal, is their target, is the summit. Patients are often surprised at how much progress they can make, and their goals change. And it's amazing to see some of my patients who don't expect to get to different levels of activity achieve this. My aim is to get them out onto our field, which is our furthest stage of the recovery process. And this is where we do return to running and sport-specific skills. The team are excellent. They've got lots of experience rehabbing both upper and lower limb injuries. We see a huge variety of these, mainly knee injuries, back injuries, and shoulder injuries. Some of these patients have been to other centres, other clinics, and for whatever reason it's not worked out as well as they'd hoped for them. And when they come here, they can have a huge amount of fear of movement, reduced confidence in their rehab experience. So we're very lucky to have these different environments to work in. Often we can use the hydrotherapy pool early on to try and overcome their fears. And we also use this later to train neuromotor control and movement control. It's exciting to work with professional athletes of all different sports, but I'm equally happy seeing patients that are less active, that are afraid to move, that want to become more active. And I often see the biggest changes with these patients. As a clinic, we believe in exercise as medicine, and by supporting patients to have the confidence to move again, to become more active, and to prioritise their health is really my main interest. Outside of Isokinetic, I enjoy spending time with my family. I live with my wife and twin 4-year-old children, so they keep me nice and active. We enjoy going out to the local woods, on bike rides, to local parks. I'm also the football club doctor at Untitled Football Club. So we're looking forward to having the fans back in this coming season.